Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer from Douglas County. Over the time we've been discussing this, we have gotten comments from people about how we should handle this COVID-19 pandemic. And some have stressed that we should do nothing and just let it play out. Others have suggested we be stricter along the way. And so we took an opportunity to use this as a learning opportunity to figure out what we should have done. We're now 6 months into it, and we've had lots of different ways of handling this across the world and across the country. And so I took this as a challenge to see if we could compare. So I'm standing in front of this great map. This is one of the most wonderful U.S. maps, made actually by the cartography department at the University of Oregon. Who knew they had one? But it's a lovely map, and I got this for when I turned 60. And it's a lovely map that I just like to look at. So here we are in Douglas County. In Douglas County, a county of about 100,000. It's on an interstate. It's mostly rural, but there is a central city of Roseburg, about 30 to 50,000 people, depending on how you look at it. And we're timber and manufacturing. So when things happen in Douglas County, I know about that. A birth in Douglas County is something that I attended and knew about. And we in Douglas County have about 3 births a day. We have about 2 or 3 or 4 deaths a day. And thus, those numbers make sense to me. You know, when I'm struck with something on the news, it says, like, there's a baby born in poverty in the world every 2 seconds. That doesn't mean much to me. Or 25 million COVID cases in the world. That doesn't mean much to me. But a death in Douglas County, a birth in Douglas County, a case in Douglas County, all do mean a lot to me. So when we were doing this analysis, we said, well, what would it look like in other similar counties across the country? So there have been websites that have looked at states and looked at to see how strict their lockdowns and how strict their control measures were. Oregon has always been a little stricter than most, but clearly not the strictest of states. The 3 states that have been the least strict have been Georgia, South Dakota, and Idaho. And they have very proudly been very not restrictive about what went on. Minimal lockdowns, no mask mandates, and minimal intrusion. So we're now 6 months into this, so we get a chance to compare what happened in Douglas County, Oregon, versus other counties in these other states. So I spent a weekend looking for Doppelganger counties. That is, counties in other states that look a lot like Douglas County. And I found a county in Georgia, South Dakota, and Idaho that are actually fairly close. The first was in Georgia, Lowndes County, which has as a central city Valdosta. It was a city that was founded in 1860 as a railroad town, and now it has as its major industries, it has timber and manufacturing, a little bit of leisure, really quite like Douglas County. County size about 100,000. And so I picked Valdosta as one of the cities. In South Dakota, there isn't really a county exactly like Douglas County, but the closest is Pennington County that has as a central city Rapid City. So Rapid City was also founded in the mid-1800s. It now is a town that has some tourism because of Mount Rushmore, but also has a military presence and has some manufacturing and some agriculture. And then in Idaho, I found Twin Falls. So Twin Falls County in Idaho, again, a central city of about 50,000, and some agriculture. It's close to I-84. So if we had to pick these 4 counties, these were all 4 pretty close counties along the way. So then what I looked at in these counties is I looked to see what has been their toll from the pandemic. So in Lowndes County, they have 3,306 cases and 53 deaths. It's a lot of deaths. In Rapid City, they have 975 cases and 33 deaths. And in Twin Falls, they have 1,573 cases and 34 deaths. Now compare this to Douglas County. Now Douglas County actually has the oldest population of any of these 4 areas. And by having the oldest population, we're really at risk for having the worst of deaths, but we only have 169 cases and only 2 deaths. So let's look at this. Reasonably even-sized counties, 2 deaths, 34 deaths, 33 deaths, and 53 deaths. I know what 53 deaths in our county would look like. I've been with families when they've lost loved ones. I've been with families while they've had people in the hospital, and I know what deaths are like. In addition, for every death, there are about 10 hospitalizations. So this means they've had over 500 hospitalizations in Valdosta. So the other thing I looked at is, well, how is this affecting the areas in town? So I spent a weekend looking at the newspapers in Valdosta. The newspapers in Valdosta, stories about COVID all the time, pretty much like the stories in Douglas County. People losing businesses, people out of work, and people having other issues. Still lots of restrictions in the hospital, no visit in the hospital. So these 500 people who are in the hospital over the time with this, no visitors. And so it's still pretty grim in Valdosta. In Rapid City, similarly, lots of discussion about what's happening, still restrictions on their hospital. Twin Falls, restrictions on their hospital, lots of cases. In Douglas County, because we've had relatively few cases, you actually can have visitors at the hospital and relatively fewer restrictions in the hospital. I then looked to see what happened with jobs. And indeed, the job difference is important. So Valdosta lost about 2,219 jobs. Every one of those jobs is a job. I know the people, they bring their kids to see me, and when they've lost jobs, this is important. In Rapid City, they had 2,239 job loss. Twin Falls was the least affected, with 1,000 jobs lost. And Douglas County, the most jobs lost, at 4,106. So I think what we can see here, the stricter approach here, far fewer cases and far fewer deaths, but more job loss. In this case, much less restrictive, a lot more cases, a lot more deaths, but fewer jobs lost. So there's a balance. So what is the economic balance on this? Well, the COVID epidemic has both direct and indirect costs. So the direct costs are things that you can actually calculate without having to do a lot of assumptions. And the two things that you can actually really directly calculate are the cost of the lost jobs. Because we know these people have lost jobs. We know what the median incomes are in each of these areas. And so what I figured out in each of these areas is how many dollars you lost from these people losing their jobs. So how many dollars would it take to totally give them back the income they had before? And we figured that out. The other thing that you can calculate directly is the cost of the hospitalizations. So for each of these deaths, there's about 10 hospitalizations. The average hospitalization about $40,000. So you could put together the per capita cost, that is the cost of the job loss and the cost of the hospitalizations, divided by the number of the people in the area. And the numbers are striking. So Valdosta, with the least restrictions, they have a cost of $495 per person. In Rapid City, $507 per person. In Twin Falls, $530 per person. And in Douglas County, $656 per person. So again, higher costs, fewer deaths, lower costs, more deaths. But look at the difference. Almost $500, $650, a difference of $161 per person. That is really not very much. Now, this doesn't take in the indirect costs. So the indirect costs are the people who have been hospitalized in these areas who are now left with long-term kidney disease or long-term heart disease, maybe disabled later on. But it also doesn't take into account the indirect costs of losing a job. So the indirect cost of losing a job may be great if you lose your house or can't go back to school, or if a business closes, there's clearly risks. But I would predict that the indirect costs are going to kind of follow the direct costs. And you'll see, again, there's a choice to make, and the choice to make is fewer cases, fewer deaths, more economic impact, or less restrictions, more deaths, more cases, and a lower economic impact. And so when we argue this, that we should do more or we should do less, we actually have data to see how this works out. And so when people are going to disagree with this, as I'm sure they will, I want them to go ahead and do their own analysis to see how this would work. So I tried to do this as a fair analysis. I did not pick, for example, the hotspots in Georgia South Dakota or Idaho, and I didn't pick a hot spot in Douglas County. Similarly, I didn't pick places that were affected one of the way or the other. I tried to do a fair analysis, and this was the analysis. You can do less restrictions, you'll have more cases and more deaths, and a lower economic cost. Or you can be stricter, you'll have fewer cases, fewer deaths, and a slightly higher economic cost. Again, I'm sure you won't agree with me, so please put your comments there, and we can talk about it further. Again, this is Dr. Bob Dannenhoffer, Public Health Officer in Douglas County. Thanks.